But Dr. Randolph, we would love to know what your professional opinion is about our readiness as a community. And then you know how people of faith gather. This is important because we don't gather like they gather at Target.
Right. Uh, First of all, I would say that the virus is still with us. It's going to be with us for a while. And we would not return to the normal ways of doing things for a while. And so each church, each congregation, each pastor needs to sort of do a self-inventory and analysis of his members and congregation. And first, asks the question, one, do we have a plan in place to be able to even address the COVID-19 issues and response? What's our emergency preparedness plan? Secondly, does that plan take into account the vulnerable population within our congregation? And therefore, it reflects taking a step back and look at, okay, what's the age range of our congregation? Who are more likely to attend worship service? You may or may not know who in your congregation that may have some chronic or underlying health problems. But when we look at our data here in Shelby County, we realize that certainly those over 65 are at a greater risk of dying if they get infected. We know that people with underlying cardiovascular disease are at a greater risk, along with diabetes and along with respiratory illnesses like bronchitis, asthma, emphysema, etc. So you're sort of going to have to look at your congregation to see. And then you have to sort of look at your rituals in terms of the way that we worship and ask the question, can we still exemplify the significance of those rituals without having to do them the way we've normally done? So, you know, the way that we do communion, how can we do that differently and do it in a safer manner? Baptism, how are we going to baptize people and do it in a safer manner? All the different rituals that we do in our worship service, you know, choir, music, how can we have music but do it safely? Because we know that even speaking loud can transmit the virus. So you could potentially have someone in the choir who may not even have symptoms and singing and subsequently transmitting the virus. And there have been reports of that happening, where a choir member not really aware sang, and several members in the choir subsequently became infected. So it's all these different measures. And so the question is, how can we worship and praise God in a more safe manner, especially to the least of these? Mm-hmm. And what we're recommending is that, you know, once you kind of do that analysis, is perhaps rather than just open up all at once, maybe do a phase-in approach. You know, maybe ask those, certainly if you're sick or having any symptom, or if you're caring for someone who has COVID, don't come to church. Continue to watch it on the live stream. You should have in place ways to ensure social distancing. Examine whether or not you're going to check the temperature of everybody who comes in, or ask any symptoms, or have available at the door hand sanitizer for everybody to, wipe their hands with the sanitizer as they walk in, and to have facial covering. So those different types of measures that we're recommending to the general population we have to incorporate in the worship service.
Okay.
So if you can do all those things, then yes, you can cautiously resume.